Beware the institutional creep. No, it's not some jerk that you work with. Being a strong advocate for person-centered care, I sometimes fear that senior care communities will drift back into their old institutional ways, whether it's how nurses deliver care or how meals are served. The institutional creep I'm talking about is real and can happen unless leadership keeps an attentive eye out for it and stops it in its tracks. Some examples of institutional creep include getting rid of medication carts, which are very medical and hospital-like, and then finding a new vehicle to use to pass medications, like a T-cart. Bottom line, it's still a medication cart. Or going from allowing residents to sleep in, to wake up naturally, and then administer their medications. Nurses wake them up to give them their medications while they're still half asleep. Those are old institutional practices. And as person-centered as we say we are, the institutional creep can be very insidious and invisible to the naked eye. Other examples of this insidious problem in senior care is how language is used. Okay? There are countless examples of institutional words that were replaced with more person-centered ones, only to return back to the old way of speaking. For instance, admissions coordinators could say that they are admitting a new resident to their care center. They then replaced it with, "We have a new person moving in." Which one sounds more pleasant to you? Do you want to be admitted or do you want to be moved in? I still hear admitted all over the place. So I'll provide this last example because language is powerful and influences the culture of the care community. Words make a difference when they are being spoken to seniors who live in the community, to family members, and to employees. So, for the most part, seniors do not want to be reminded that they are living in a skilled nursing facility. For the most part, seniors don't want to remember that they're receiving rehab, that they're in a rehabilitative center. But we are still using these words. They might prefer words that remind them of home. Even though it's not home, even though it can never be home, words do matter, I think, in these cases. So it's important for leaders in senior care to remember that culture change can become unchanged, unraveled, and person-centered care can go back to the old days of institutionalized care. We don't want that to happen. Watch how care and services are being delivered and listen to the language of the care community. Be honest and ask yourself if your culture is still one of positive transformation or a return to the old ways of doing things. So there you have it. Beware the institutional creep. I'm Dr. Jim. I'll see you soon.